So later life. So we're talking about those, 65 and older, and we'll be getting to the modifiable risk factors for this age group. Just as important to make changes whenever and wherever we can. And so the Lancet Commission identified 6 modifiable risk factors to address in later life, and those are smoking, depression, social isolation, physical inactivity, air pollution, and diabetes. And it's also important to note that those who are currently living with dementia will also benefit from addressing these factors as a way of maintaining cognitive reserve and physical health. Okay, so smokers are at higher risk of developing dementia than non-smokers. Smoking accounts for 5% in reduction in dementia prevalence if eliminated. Worldwide, we've got 35% of non-smokers as adults and 40% of children exposed to secondhand smoke. So while there's less research related to the impacts of secondhand smoke and dementia, there is indication that the same cardiovascular effects observed in smokers are present in those who are exposed to secondhand smoke. And so there are several ways that smoking can increase a person's risk factors for dementia. So that includes the narrowing of blood vessels to the heart and the brain, nerve cell damage, and all those things can cause inflammatory responses that can put those who are genetically predisposed to developing dementia at even higher risk. And we know that those who have the ApoE4 allele, that is a genetic risk factor for dementia, actually tobacco smoke can further increase the risk of developing dementia if they're carrying that ApoE4 gene. And so the commission recommends that people just stop smoking, and stopping smoking at any age, even those who are over 60, can significantly reduce the risk of dementia. Now depression, which is found to be an increased susceptibility for dementia, but it's also part of the early stages of the dementia journey. And so it can be an early symptom that flags the onset of dementia even before more specific signs or symptoms developed. And so because of that, it's actually really difficult to tease out the effects of dementia as it relates to dementia risk. Now, a study done in the UK followed up more than 10,000 people that had depressive symptoms in later life, and they were increased risk of dementia, but those who were younger were not as at higher risk. A smaller but longer study, so those, we'll call them longitudinal studies, so those over several years, found that almost 5,000 cognitively healthy men who were depressed was associated with an increased risk of dementia, but that this link was accounted for by the fact that people developed dementia within 5 years of their depression. So again, it's really hard to tease out, what came first. Was it the depression or the dementia? But interestingly, those who took antidepressants were not at a reduced risk for dementia. So if we're looking at ways to manage depression symptoms, another study looked at the use of, I can never say this drug name, citalopram. It's an SSRI antidepressant, excuse my pronunciation, which has been found to reduce amyloid plaque generation and formation in animal models. And in these animal studies, it found that 4 or more years of receiving antidepressants delayed the progression to clinical diagnosed Alzheimer's disease. So just pointing out that this is an animal study, it hasn't been studied in humans, but that there is indication that it can actually help with prevention. One of the challenging things is that people treated with antidepressants are more likely to differ on other aspects than those who are not treated for depression. And again, this is sort of one of these factors that is just, we're needing more information on, how conclusive statements that we can make on antidepressant treatments to reduce dementia as a risk factor. So we're still, jury's still out. Okay. Social isolation. So low social contact or social isolation is when a person experiences low quantity and low quality of contact with others. And so this is distinct from loneliness, which is more of a subjective feeling that has less to do with how often you're interacting with people, but more about a feeling of not being connected with people. And so it relates to, so social isolation really relates to, whether a person lives alone and whether they see friends and family regularly or engage in social and community activities. Like some of the other factors that we've mentioned, isolation might occur as a consequence of dementia itself. So research has shown that social isolation places people at an increased risk for hypertension, for coronary heart disease, for depression, and dementia. And as we hit mid and later stages in life, in the life course, social contact becomes more precarious, right? Several research studies demonstrate that less social contact increases the risk of dementia, particularly for those who have been single for most of their lives or those who have become widowed, as compared to those who are married. And so this association between social isolation and dementia risk was observed, regardless of sociocultural settings, right? Sort of across the board, this is the trend that researchers have noticed. And so how do we address this? Well, social contact is an accepted protective factor now, and that both enhances cognitive reserves and also encourages beneficial behaviors. And it's so important that to our overall health and the health of our communities, that now healthcare providers are actually engaging in what is called social prescribing. And it's a means of connecting at-risk people to a range of non-clinical services in their communities, right? So it could be volunteering, staying connected with a phone call service, engaging with others via social media. And the importance of social contact holds true for most cultures around the world, and also regardless of the person's sex and gender. So staying connected with others is a great way to buffer against the hard stuff in life. Being in community, contributing through volunteer work, joining walking groups, book clubs, all of these things can help reduce your risk of developing a cognitive impairment. Okay, physical activity. So physical inactivity can be an early sign of dementia. And we know that patterns of physical activity change with age, generation. What was done in previous generations might be different now in terms of how we get physically active, and also changes with health status and also across sex, gender, social class, and different cultures. And as we age, other factors may make it difficult to stay as physically active as we'd like, right? So and so a very large study of just under 29,000 people aged 30 to 60 showed that weekly midlife moderate to vigorous physical activity, right? So you're getting sweaty, was associated with reduced dementia risk over a 35-year follow-up period. So the reasons why physical activity is so important for brain health and physical health is because it is shown to reduce the risk of blood pressure and health disease, but blood pressure disease. It helps you maintain coordination and balance. It increases blood supply of nutrients to your brain. It reduces the risk of stroke, type 2 diabetes, and cancer. And it can improve your mood and symptoms of depression. And for these reasons, the Lancet Commission recommends regular exercise as a protective factor against dementia. So they're talking about, 150 minutes of moderate to intense exercise per week, or 75 minutes of vigorous intensity workout. And you can break these time chunks into smaller, more manageable pieces. But what I think is the most important thing to take away from this is that if you're not regularly physically active, doing anything is better than doing nothing, and doing something that you really enjoy that gets your body moving is just going to be a win, right? And doing what feels right and what feels good for you is going to be important to sustaining those physical activity practices. Okay, and now we're learning through research that air pollution and particulate pollutants that are associated with poor health outcomes, including non-communicable diseases like dementia. And this is one of the new risk factors that was added to the commission since the 2017 report came out. Now, research that has been done on animal models has shown that airborne particulate pollutants, so that's like minute particles in the air, speeds up the degeneration of brain cells or neuron degenerative processes. So as we inhale certain pollutants and particulates, they enter the lungs and they circulate in the blood and can move up to the brain. And this can lead to cardiovascular and cerebrovascular diseases that impact cognitive functioning. So it's high levels of nitrogen dioxide, fine particulate matter, so from traffic exhaust, pollutants from agriculture, wildfires, have shown a strong association with dementia. We also know that there are societal inequalities, right, that contribute to how exposed a group of people are. And so a 10-year study that was conducted in the US showed that the burden of dementia and excess death in relation to particulate matter was highest among Black individuals and those in socioeconomically disadvantaged communities. So reducing your exposure to pollutants and particulate matter as much as possible can help lower your risk of developing a dementia. And some things you can do, which is to avoid or reduce your time outside. If there's active wildfires in your region, trying to stay indoors, paying attention to the air quality information, and also using portable air cleaners in your home and making sure to change those filters regularly can really help reduce your exposure. Okay, and diabetes. So diabetes occurs when there isn't enough insulin produced by your body, or when your body just doesn't respond to insulin as it should, and that can lead to spiked blood sugar levels. And so there's two types of diabetes. The first, type 1, is a condition that you're born with. And the second, type 2 diabetes, develops over the course of someone's life. Now, research that has pooled and analyzed 2.3 million people. This is called a meta-analysis, when you're taking research from various studies and you're trying to come to a conclusive or substantive conclusions about what you're observing. So the study took 2.3 million people's data on type 2 diabetes, and it found that this type of diabetes increases a person's risk of developing dementia for both men and women, but slightly higher for women, which highlights the importance of gender and sex differences in the dementia experience. And that this risk is impacted by how long someone has diabetes and how severe it is and how well it's been managed over the life course. And so people with type 1 diabetes, severe sugar highs and lows are associated with increased risk of developing dementia. But we also want to note here that there's certain communities that might be at a greater risk. And so Indigenous peoples have an increased risk of developing type 2 diabetes. They tend to be diagnosed at a younger age. They have more severe symptoms and face a higher rates of complications, which may place them at an increased risk for dementia. And so there's particular communities that we need to provide extra additional support to. It is unclear at this point whether any particular diabetes medications reduces the risk of dementia, but we do know that eating a balanced diet, right? So a range of different foods of all different colors in the right proportions can help reduce the risk of developing type 2 diabetes and thus lowering your risk for developing a dementia.